A bunion, medically known as a hallux valgus, forms when the big toe points towards the second toe, forcing the first metatarsal head to stick out medially. A bunionectomy with correction of the deformity via osteotomy is the surgical procedure to correct a bunion. This involves removing some of the prominence on the big toe at the bunion using a saw. The bone saw is then used to create a chevron-shaped cut towards the distal end of the metatarsal, which allows the bones to be realigned. A screw is then inserted to fix the bones into their new corrected position. Medically known as hallux valgus, is a deformity of the forefoot in which the big toe drifts towards the second toe. The first metatarsal head sticks out medially, appearing as a lump on the inner side of the foot. As the deformity gets worse, the big toe also rotates and slightly elevates so that the remaining metatarsals at the base of the lesser foretoes have more load and become painful. The skin over the bunion is often red and sore, and the joint may feel painful. Movement of the big toe may also be restricted, particularly if there is arthritis in the joint. Bunions generally develop because of a family history. Then stress on your foot, particularly when wearing tight shoes with high heels, will then bring this genetic predisposition to the forefront. Anterior cruciate ligaments are most commonly caused by having the upper leg displaced backwards or sideways by impact, while the lower leg is in a stable position, or by pivoting and jumping. This animation illustrates a complete tear of the ligament. As a crucial stabilizing ligament, a torn anterior cruciate ligament can cause severe knee instability and may also require reconstructive surgery. This is a treatment animation for a torn anterior cruciate ligament. It involves harvesting a portion of the hamstring tendons to create a graft that can be used as a replacement anterior cruciate ligament. A portion of tendon is removed from the semitendinosus and gracilis muscles. These tendons are then connected using a baseball stitch to create a strong graft. The damaged anterior cruciate ligament is removed, and holes are drilled through the tibia and femur through which the graft will be passed. The graft is positioned and secured using screws and staples. Femoroacetabular impingement occurs when the femur and/or acetabulum are abnormally shaped, causing the bones of the hip joint to grind against one another instead of gliding smoothly over the articular surface. With time, this friction can cause the articular cartilage to break down and the labrum to tear, resulting in pain and a limited range of movement. Treatment is via arthroscopic surgery to repair the damaged joint. Injection of saline expands the joint, allowing access to the site of injury. A scope is inserted to visualize the joint. A shaver is then used to remove the excess bone growths and to debride the damaged labrum and the acetabular cartilage. The saline is then extracted, restoring the joint, and the incisions are sutured. Femoroacetabular impingement occurs when the hip bones are abnormally shaped. As a result, the bones articulate in an abnormal manner, and this causes damage. The head of the femur and/or the acetabulum may form bone spurs. These growths cause the bones of the hip joint to grind against one another instead of gliding smoothly over the articular surface. With time, this friction can cause the labrum to tear and the articular cartilage to break down, resulting in pain and a decreased range of movement. This animation shows a particular type of femoroacetabular impingement referred to as Pincer type. It is characterized by bone spurs that form on the rim of the acetabulum, which can lead the labrum to be crushed under the acetabular rim.